Again, let me start with the last. There was a question about teenage pregnancies that I think escaped the boss' attention. Yes, we got this report from Machakos indicating that we have 4,000 teenagers who have become pregnant since the onset of this pandemic. Remember, we had our first case in March. On the 13th of March is when we officially declared the first COVID-19 case in Kenya. On average, mothers who come for antenatal services in healthcare facilities come in the third trimester, the last 12, 13 weeks of the pregnancy. So if you go back to March and now we are on the 18th of June, we are basically talking of the first or second early second trimester. So it's very unlikely that even if these young girls fell pregnant, they have already gone to the facilities for somebody to verify that they are indeed pregnant. But that notwithstanding, our team at the Division of Reproductive Health are looking at this data. Remember also in the Kenya Demographic Health Survey of 2019, 400,000 teenagers get pregnant every year. So one county reporting 4,000 would also not be far-fetched. But I think we leave it to the team at the Division of Reproductive Health to look at the data and compare it with what we have in the District Health Information System. Then we shall be able to give you an appropriate answer. In terms of the deaths, we reported 10 deaths today. 9 of these deaths occurred in health facilities, 6 at Kenyatta University, Teaching, Referral and Research Hospital, 2 occurred at the Coast General Hospital in Mombasa, and 1 in Nairobi Hospital. And of course, I told you about 1 community death in Kiambu. That tells you that our health-seeking behavior is changing. Many people are going to the facilities. And this is not an indictment on the treatment of these particular cases. Remember, there's no cure for COVID. The treatment is basically supportive. So if you come and you have respiratory failure or you have kidney failure, basically the role of the doctors and nurses and the laboratory people is to support you throughout that period and hope that you are able to pull through. I'm confident that even though we lost this number of people, these deaths occurred in facility and they received the best care that we could be able to afford them. In terms of the proportion of the 6,000, what came from the backlog, we had a backlog of just about 5,000 tests. So for today, maybe about 1,000, 1,500 could have come from the backlog. And I'm glad again to report that we have now since cleared the backlog of tests. There is always danger that if you have a backlog like that and somebody tests positive, after you have kept the specimen for 3-4 days or 1 week, and the person is moving around, of course, there's always that risk that he or she would be able to transmit the infection to other people. But what else could we be able to do? There was nothing because we didn't have the test kits to be able to confirm. What we pray and hope is that the global supply chain pipeline will get better and we'll have consistency in the test kits that we continue to get. There was an issue about transmission and contact tracing. It is usually very, very difficult to be able to do contact tracing once you have established community transmission. So linking somebody with a contact becomes very difficult and it becomes very, very expensive and tedious and tiring for the healthcare workers. So then you shift your plan from doing contact tracing to basically trying to contain the spread of the infection. Out of these 10, 7 of them, out of the 10 mortalities reported today, 7 of them had underlying medical conditions, with 4 having diabetes mellitus, 1 having hypertension, 1 had chronic myeloid leukemia or bone cancer, and 1 had HIV. And I think this is the second or third HIV COVID positive case that we are reporting. Studies from South Africa have indicated that those who are taking the ARVs appropriately are able to achieve viral suppression. So it is again our call to those who are on treatment to ensure they adhere to the treatment. Our health facilities are available, open 24/7. Please go for your prescription refill. The healthcare workers are properly trained, they are properly geared, and they are safe. So don't fail to take your medicine because you fear getting COVID. Because if you get COVID-19 and you're not taking your medication, it's like you are sentencing yourself to death. Thank you.